My name's Tim McHenry. I'm an orthopedic spine surgeon at the Southeastern Neurosurgical and Spine Institute, and I practice in the Greenville Hospital System. Well, orthopedic spine surgery really encompasses most of spine surgery, and there's really not a lot of difference in probably 90% of what we do compared with a neurosurgeon. There are some things that are more towards the orthopedic spine surgery end, like scoliosis, and then there's some things that are more towards the neurosurgical end, like tumors in the spinal cord. But most of the stuff is really, can be done by either specialty, and it includes problems with arthritis of the spine, fractures of the spine, tumors of the spine, deformity like scoliosis or kyphosis, and those are most of what we do. I grew up in New Jersey. I'm the oldest of 4 boys, and I have a brother who lives in Clemson now, one that lives back in New Jersey, and one lives in Massachusetts. We all played soccer growing up for the high school. 2 of us swam, me and my brother Mike, and the other 2 guys played basketball. We also ran track and were Boy Scouts and did those types of things. I went to college at MIT in Boston, and then I went to medical school at NYU in New York City, and I did my residency at the University of Texas Southwestern and trained at both Baylor College of Medicine for orthopedic trauma surgery and at the University of Washington for orthopedic spine surgery. I think the most important thing when we're seeing a patient with a spinal disorder is to educate the patient so they understand what their condition is, why they're having the symptoms or problems they're having, and what they can do to try to make it better, and what we can do to help them to make it better. But I think education is the most important part, so we make sure we spend enough time to help them understand what's going on, but also to make sure they understand their options. So I served 10 years in the U.S. Army on active duty, and I was orthopedic surgeon for the whole 10 years. And I think, in the end, I think it, as with anybody that spends that much time doing something, especially in the United States Army, that really, to some degree, makes you who you are. And for me, I think it was a positive experience and really a privilege to be able to both serve the country, but also serve the troops. And as far as doing orthopedic surgery in the military, the military population's relatively young and they get orthopedic injuries. So the things that we were taking care of and the troops we were caring for in conflicts I was in and back here in hospitals I was at were primarily orthopedics. A lot of our patient care is provided with residents helping, and I think that ends up being better patient care, and I think the reason for that is that we have another set of eyes, another doctor who's gone to medical school who is monitoring the patient, examining the patient. And what it does for me as a surgeon is when we're performing surgery and I'm showing a resident surgeon how we do something and what we're trying to accomplish, and they ask questions about why are you performing it this way or why are you doing it that way, I think that also feeds into the self-examination point, because a lot of things we do, we've done that way for a long time, and we've always done it that way, but I think when you ask why are we doing it that way and what do we expect to happen, it sometimes leads us to question if there's not a better way to do it. So I think that when you get care at a place that's a teaching hospital where residents are involved, it ends up being better care, because I think that we ask more questions and we examine exactly why we're doing what we're doing, and we're more critical with our outcomes as well. I think what we offer at the Greenville Hospital System for spine care is exceptional because we have a number of physicians under one roof who have a wide range of experience, who've been different places, who've been educated at different places, and bring that all to bear to taking care of our patients. And I think that having had the experience of being at a lot of different places in my life and seeing a lot of different things and being educated at several different institutions, I think that it allows me personally to have a better perspective and have had more experience. Well, I think one of the benefits of the Spine Institute is our post-surgical care. After surgery, a lot of the care is rendered by physical therapists, and we have a physical therapy team who specializes in neck and back care at ProAxis, and we have therapists who, at our location, who are focused on back and neck conditions and have extra training in how to provide care for them. Well, I think what makes a good spine surgeon is understanding what we're trying to treat, understanding the goals of the treatment, but also the limitations of the treatment, and being able to educate the patients in both. So I have 3 children. The oldest is 10, and he's a Cub Scout, and he plays basketball for the church league, and I have a daughter who's 8, and she plays basketball for the church league as well. And actually both my daughter and my son also do karate, and they're purple belts, and so we spend a lot of time going to tournaments with them for that sort of thing. Then we have a 7-month-old, and right now he drinks a lot of formula, and he started on solid foods, but he doesn't do karate yet. So.